evening and welcome to our COVID-19 update. I'm Ladi Akiridoluale. Here are the highlights at this hour. In spite of COVID-19 pandemic, President Buhari says his government is responding to the people's demands, asks protesters to leave the streets while their demands are met. Nigerian Medical Association asks federal and state governments to allocate not less than 15% of their annual budgets to the health sector. And France extends curfew as number of positive cases increases. Countries around Europe struggle with rising infection rates of COVID-19. We start off tonight in Abuja, where President Muhammadu Buhari has assured Nigerians of the readiness of his administration to cushion the effects of the deadly COVID-19 virus on the country. According to the president, who addressed the nation earlier this evening, programs are already in place with more to come to ensure that Nigerians, particularly vulnerable groups, are positively affected. He was speaking on what he condemned as the destruction that characterized the NSAS protest in parts of the country and asked the protesters to let peace reign.
I am indeed deeply pained that innocent lives have been lost. These tragedies are uncalled for and unnecessary. Certainly, there is no way whatsoever to connect these bad acts to legitimate expression of grievance of the youth of our country. The spreading of deliberate falsehood and misinformation through the social media in particular, that this government is oblivious to the pains and plight of the citizens is a ploy to mislead the unwary within and outside Nigeria into unfair judgment and disruptive behavior. On the contrary, both our deeds and words have shown how committed this administration has been to the well-being and welfare of citizens, even with the steadily dwindling revenues and the added responsibilities and restrictions due to the coronavirus pandemic. Government has put in place measures and initiatives principally targeted at youth, women, and the most vulnerable groups in our society. These included our broad plan to lift 100 million Nigerians out of poverty in the next 10 years. The creation of 75 billion Naira National Youth Investment Fund to provide opportunities for the youth and the micro, small, and medium enterprises survival fund, through which government is A, paying 3 months' salaries of the staff of the 100,000 micro, small, and medium enterprises. B, paying for the registration of 250,000 businesses at the Corporate Affairs Commission. C, giving a grant of 30,000 Naira to 100,000 artisans. And D, guaranteeing market for the products of traders.
The reason why they brought this stuff here is because they know this place is not. People don't know it as well.
Social media videos circulating there show a warehouse located in the Maza area of Lagos being looted earlier today. According to reports, the warehouse has materials donated by public-spirited Nigerians for distribution to the less privileged. Some of the items were donated since July of 2020 at the peak of the COVID-19 pandemic. The items include bags of rice, wheat, noodles, and other food items.
COVID-19 relief food like this is what people are taking.
Meanwhile, the Lagos state government has condemned the vandalization of that warehouse where all the food palliatives donated to the state by the private sector coalition against COVID-19 CACOVID were being kept. The state governor, Babajide Sanwo-Olu, had on September the 22nd taken receipt of the food palliatives meant for distribution to the indigent members of the population. According to the Commissioner for Agriculture, Ms. Abisola Olusanya, the warehouse in question is not state-owned, and its usage was only made available to the CACOVID group. According to her, the distribution of the food items was ongoing but had to be halted due to the End SARS protests. The social media had been awash with a video of the warehouse being looted. In Zamfara State, Nigeria's northwest region, civil servants from level 1 to 10 have resumed normal official duties. The Special Advisor on Media and Public Enlightenment to the Governor, Zelani Bupa, while speaking with Channels Television in Gusau, said several measures had been put in place before the announcement of the lower-level resumption. A visit by our correspondent, Salaudin Adeni, shows civil servants walking through the disinfectant gate mounted at the entrance of the State Secretariat.
And secondly, the state government has directed the Ministry of Health to make sure that it has put all the necessary precautions that are needed as people are going back to work. You will recall that last week most of the offices have been fumigated so that if there are reptiles and so on and so forth in the offices and other dangerous creatures after months of closure. And secondly, you can remember even during when the COVID-19 was high, the state government has provided the civil servants and other people in the state with disinfectants, that is these sanitizers, and then also the face masks free of charge. And the governor has directed that this should be also provided. And since the government cannot sustain it, all civil servants are expected now to continue where the government stops until we are free from COVID-19.
The Minister of State for Health, Dr. Oloronimbe Mamora, says the government at all levels is collaborating with other agencies to bring healthcare delivery closer to the people. The minister explained that swift access to healthcare services will in turn assist in the reduction of death linked to COVID-19.
Our experience with managing the pandemic shows that many of those who died could have been saved if they had access to services on time. During our intervention in Kano, ambulances were deployed to evacuate cases, especially those in critical conditions, to hospitals for treatment. The National Emergency Medical Services and Ambulance System, NEMSAS, is designed to provide Nigerians with prompt access to medical treatment when needed. Last week, we met with the Corps Marshal of the Federal Road Safety Corps to discuss a collaboration for the deployment of some of the critical assets of the Corps, such as ambulances, emergency medical treatment personnel, and communication infrastructure for the emergency medical treatment program. The collaboration will also ensure that accident victims have access to emergency medical care in health facilities without having to wait for payment or deposit.
All right, let's talk to Titi Adewusi, co-founder of Niger Kids. She joins us via Skype from the Surulere area of Lagos. And we're talking a bit of learning today, remote learning, kids learning, because with everything that's happened, the resurgence of cases, the NSAS movement, schools have been shut down yet again, just so soon after they were reopened. Thank you, Chichi Adewusi, for joining us on the program. Welcome.
Thank you. Thank you for having me.
The schools have been shut down again. What are the possibilities this time of a more organized learning procedure, the remote learning, online learning, if you like? What do you think?
I will start by saying that we are definitely in a better place now than we were in March. You know, in March, it was mayhem. But we've done this on and off for the past couple of months. So most schools have actually gotten in a better place now than they were in March. So various schools have done both the public and private, they've done various forms of remote or distant learning, whether it was the television, whether it was radio, whether it was WhatsApp, whether it was Zoom, whatever form, they did something. And they were able to learn their lessons from it, the good, the bad, and a bit of the ugly, and came out with what do they need to do better. So they were a bit better prepared, especially those that, had gone through the online learning better. They were better prepared to easily transition. Even while the protest started, a lot of schools proactively, even before the Lagos State governor announced it, a lot of them proactively transitioned to the virtual learning. So this just shows us that remote learning and distant learning or virtual learning isn't going anywhere. It's not going anywhere. It's here to stay. It will always be with us. So my advice to the schools, to administrators, to the government is that we need to plan for it. We need to ensure that we have the relevant infrastructure that will support remote learning going forward in the future.
The issue of cost of data as well as the appliances used for remote learning has always been, from experience now, the challenge for many of those who ought to be learning remotely at this point in time. What can people who face these challenges do?
Honestly, the cost of the device and data is indeed a major challenge. And one of the things it does is that it then creates a wider divide between the haves and the have-nots. So one of the good things that have come out of COVID and the lockdown is there has been more flexible plans in terms of getting these devices. So a lot of banks, medium-sized microfinance organizations, places like EdFin have come up with various flexible options for parents to be able to acquire these devices. Other things is that Lagos State had also gotten support from a number of corporates in terms of giving them a number of devices we shared out. So we're still a long way, to be honest, when it comes to the devices, but I think we need more incentives and government policies that will make those devices more affordable. And the data is another thing. I think when it comes to data, I have to, not say some of the good things that the telecom operators have done. Some of the good things they've done is that they've gotten some special packages for schools and teachers. But even with that, it's still quite, quite expensive relatively. So one of the things that I would propose that they need to do is that they need to explore having zero-rated application, which means that when you log on to some of these sites that are educational, you're not actually incurring any cost in terms of data. They need to do more of that to support it, or significantly subsidize, usage of data on certain educational sites that make them a bit more affordable. I think it's important that, telecoms operators and the various providers of all this data provide some way of giving back to society and their social corporate responsibility in making this affordable to way more people, and also supporting it in the rural areas. Remember that a lot of these providers are focused more on the cities, but if we need data in the rural areas, we need them to go to those places. So that's where I would say that we also need government support in terms of broadband penetration in the rural communities. How do they, what incentives are they going to give to these telecoms providers that will make them go there, and especially to support online education?
The really young ones present a challenge, not only because of all the things that we've talked about already, but because their attention span is really limited, and therefore, in order to keep them on a device, watching or listening to anything for any length of time means that that thing really has to be interesting. How do we do that now that many of them are back at home again?
I like the word you use. How do you make it interesting? And that's really the secret with the younger ones. How do you make it engaging? That's why you see that a lot of learning for them is hands-on. A lot of learning for them is using songs and dance and activities to keep them engaged. And that's really the secret. We have quite a number of apps that people have done really for the younger children to keep them engaged. A lot of people run from that particular age group and go for more for the older people. But there are applications, even Niger Kids, the organization that I'm one of the co-founders, that actually has things like games and various songs and nursery rhymes to keep them engaged. I remember that a lot of these kids are engaged watching TV, so it means that with the right app, they can be engaged. But of course, it's not recommended they are on the screen for too long. They still need to do a lot of physical activities because that's really more of what they need at this time: hands-on activities, physical activities, and social activities.
Stay with us because there's still quite a bit to talk about with this issue of remote learning. I'm going to talk about the older ones whom you mentioned a little bit earlier on, and the absence of any legal or even educational framework for online learning because it's not going anywhere anytime soon. So please stay on with us. We'll be back after this short break. Thanks for staying tuned. Welcome back to our COVID-19 update. Before the break, we were speaking with Titi Adewusi, co-founder of Niger Kids, who joined us via Skype from the rural area of Lagos. Before the break, we were talking about the really young ones and their attention span. The older ones are a different kettle of fish. They've got the attention span, but again, they have a different challenge, which is when they get on, there are so many things competing for their attention on the device, apart from the educational part of it. How do we keep them on the educational part?
I think, with everything, children like things that are fun and engaging. And it's important that you realize that learning has to be fun and engaging. So there are a number of apps that are out there that come with a fun angle that make it very engaging for them to learn. Some can be videos. So we have, very engaging videos from apps like U-Lesson. We have from places like Schoolgate, Gradely. And then we have like games. And so like
We do seem to have lost Titi Adewusi there. We'll see if we can get her back. But even while we wait for that, let's bring you up to date with the NCDC figures for the day. Even though it's not clear how much of COVID-19 sample collection and testing is still going on across the states of the country owing to the NSAS protest situation. The latest figures coming from the NCDC, that's the Nigeria Center for Disease Control, as of 21st of October shows that 37 new cases were recorded in the country. The Presidential Task Force on COVID-19 had earlier in the week said that cases of COVID-19 will definitely increase in the coming weeks owing to the mass gatherings from the NSAS protests. The new cases were reported from 8 states and the FCT, which recorded 8 new cases, that is. Lagos recorded 7, Taraba and Rivers 5, Adamawa 4, Kaduna 3, Anambra, Osun 2, and Ogun State 1. Till date, 61,667 cases have been confirmed, 56,880 cases have been discharged, and 1,125 deaths have been recorded in 36 states and the Federal Capital Territory. A multi-sectoral National Emergency Operations Center activated at Level 3 continues to coordinate the national response activities. Well, I'm made to understand that Titi Adewusi is back with us. We lost you for a bit there, but you were just about to answer the question about how to keep the older students, probably in early junior secondary and senior secondary, who are also incidentally at home, engaged in this process.
Okay, so what I was saying is that it's important that it's fun. So there are a number of apps. Some are very, serious and studious, but they're also the ones that are fun. They're like games, they're like quizzes, they have competitions, they have levels, they are badges. So it's almost like playing a video game, which is what, children already like. And so we have, quite a number of them that are there. We also have, Ninja Kids. I will start with that, which is really about games and quizzes that makes it a bit more engaging. We have Gradely. We have so many other ones out there that are just, as fun, as exciting for them. I think for the senior secondary who are, doing more of exams, we also have things to support the exams. So we have things like pass.ng, Pass Now, a Success Box. So they are out there, a lot of Nigerian edtech companies supporting that, and then we also have some foreign players as well. We have the likes of Khan Academy, we have ABC Mouse, ABC, the list goes on and on.
Well, I mean, even though a lot of people would say that many of these things would probably keep the kids engaged, once school reopens again and physical going to school is possible, do you see a situation where remote learning will once again recede into the background, and should it recede into the background?
Well, I would say I will answer the second question first by saying it shouldn't. Because what remote learning does is that it gives you a whole lot more resources than you can most likely have in your school. So let me give an example. If you have a library of thousands of books online, so I give an example. Epic is a fantastic platform that has thousands of books. It means that your children can access those books. We have the Google Read Along app. It has thousands of books. So what remote learning does is that it gives you a bigger access to a lot of things. So it can be used as homework. It can be used as, even time out during class. It can be used as, sessions where you just allow the children to go on those applications online and learn so many things. They can do virtual tours of places they can visit online. So I think schools that have used it well in the past couple of months realize that this shouldn't go anywhere. It's something that they need to continue to use and continue to blend. I think the other thing it does is that it gives you access. You can actually have access to world-class French lessons outside of the country by just, using an app and using something online and remote. You can also reach so many people. During the COVID lockdown, people were in Jos, attending schools here in Lagos. And that's the advantage of online learning. It should not be set to the back. It can allow all that traveling we're doing to go back and forth to do further education. We can actually now do it at home. So I don't see it going anywhere. I see that schools that are proactive, schools that are, very strategic, will continue to use remote learning. And I think that's something that the government really, really needs to support. It means that you can reach a whole lot more people beyond the classroom. Think of how many people are watching, even though they might not have a TV, they're also watching online, the channels news right now. That's the advantage of remote learning. You can reach so many more people. People can be at home learning. Learning never has to stop. And that's what this lockdown, and even now that schools are closed, has taught us. Learning doesn't have to stop once we have, other options. Remote learning is here to stay. Anybody that is should I say wise, we realize that it's not something that should push to the background. I think what's important is how do we scale up the teachers? How do we scale up the students so that they're more familiar with it? So even when they go home, they know how to log on to these apps, continue to use them and learn from them. How do you continue learning outside of formal classroom, outside of brick and mortar? We can reach a whole lot more people with remote learning than we can with physical classroom. And I think it's something that the government needs to look at as a top, agenda point with regards to reforms in education.
Thank you so very much, Titi Adewusi, co-founder Niger Kids, for your perspectives on this very important issue. Thank you so much for joining us.
Thank you. Thank you for having me.
From there, we go to the northwestern state of Katsina, where the state government says as part of efforts to further empower the youth in the post-COVID-19 era, plans have been made to establish a Faculty of Arts and Sciences at the Umar Musa Yaradua University in Katsina State. The faculty, if established, will eventually help the graduates sustain themselves after graduation without necessarily relying on government for white-collar jobs. Speaking during the groundbreaking ceremony for the construction of 30 housing units for university staff, the Governor, Aminu Masari, explained that the government is more focused in the area of education for sustainable development.
The administration has carved an initiative for itself in revamping the tertiary institution. For example, at Umar Musa Radwa University, the government has provided infrastructure, lecture theaters, laboratories, student accommodations, and new health center, which has been well equipped to serve the university community and its surroundings. Plans are also underway for the establishment of Faculty of Earth Sciences, which will eventually help the graduates to sustain themselves after graduation without necessarily relying on government for white-collar jobs. Another feat recorded by the administration is its support to the university in providing state-of-the-art equipment for the Faculty of Medicine and also provided funds for the completion of the Faculty of Law. Similarly, the government spearheaded the effort of the university towards the establishment of the Faculty of Agriculture currently being housed at Line Minister in Malumfashi local government.
In Adamawa State, the chapter of the Nigerian Medical Association has commended the state government for the commitment shown in combating COVID-19. Speaking at the opening ceremony of the association's activities marking 2020 Physicians Week in Yola, its chairman, Ibrahim Musa, says the state government has done well by providing accommodation for staff of the treatment center and prompt payment of their allowances and the establishment of the infectious diseases center at the state specialist hospital. They have asked for the establishment of a PCR molecular laboratory at the Federal Medical Center in Yola and the Infectious Disease Center, amongst several others, while seeking for yet more interventions.
The COVID-19 outbreak was an unexpected, alarming health crisis that has tested even the best health systems, even of Europe and America. COVID-19 pandemic has nakedly exposed the inadequacies of health systems around the world in response to the pandemic. Sadly, many health systems across the world were overwhelmed by the pandemic due to inadequate emergency preparedness and response, largely due to inadequate human resources, infrastructural deficit, and medical consumables deficit, including personal protective equipment and other protective equipment. Gross underfunding of the health sector is a major factor that contributed to this. 19 years ago, precisely on 27th April 2001, African governments made a historic pledge in Abuja, Nigeria, to allocate at least 15% of their annual budgets to the health sector. This vow has become known as the Abuja Declaration. As COVID-19 spreads and wreaks havoc across the world, the question must be asked, what has become of the vow allocating 15% national budget to health? No disease has ever before laid bare the state of the country's health sector like COVID-19. COVID-19 has revealed acute shortages of critical life-saving equipment, such as ventilators, intensive care beds in our hospitals. Their shortages of medical capacity has further put a spotlight on the poor state of health in Nigeria. There is some distance still to travel to ensure that health care is affordable and accessible to all citizens for universal health coverage to be achieved.
In Kaduna State, the Medical Association there has echoed the call from the Adamawa branch about the allocation of 15% of the annual budgets of state and federal governments to the health sector in order to strengthen them, especially in the face of COVID-19. The state chairman, Dr. Liu Sakumba, made the call in Zaria, where he also frowned at the nation's weak health system, which he notes is largely due to inadequate funding. The Medical Association also laments the lack of effective communication and awareness in sensitizing the people, especially at the community levels, on how to avoid the spread as well as the management of COVID-19.
The Nigerian doctors frowned at the overtly obvious weakened health system, especially in the face of COVID-19. And we are urging all these relevant stakeholders to play their part to see that this COVID-19 pandemic becomes a turning point to strengthening the health system in the country. As you are aware, one of the fundamental reasons why we have continued to suffer this current weakened health system is the fact that the budgetary allocation to health as it stands, even in 2020 budgets, is far less than 5%, as opposed to the 15% budgetary allocation. And you know basically that everything becomes possible with funding. So we are urging the federal government, the state government to implement the Abuja Declaration of budgeting 15% budgetary allocation to health. And that way, I believe the health system will be strengthened.
In Yobe State, Governor May Malabuni says significant numbers of children are unprotected against vaccine-preventable diseases and that there was a decline in coverage of other primary health care services owing to insurgency as well as the COVID-19 pandemic. The governor was speaking at the flagging off of the integrated medical outreach organized by the State Primary Healthcare Agency in collaboration with the Multi-Sectoral Crisis Recovery Project in Damaturu. The Commissioner for Health, Dr. Lawal Gana, explains that the program is aimed at providing free health care and increased access to immunization for children aged 0 to 2, as well as targeting pregnant mothers. We do apologize for the mix-up that the governor was actually flagging off the medical outreach at the State Primary Healthcare Agency in collaboration with the Multi-Sectoral Crisis Recovery Project in Damaturu. Let's speak to Dr. Abi Abraham, consultant public health physician, who joins us via Skype in Lekki. Good evening, Dr. Abraham. Thank you for your time. Welcome.
Good evening, Mr. Akeredolu Ali. Thank you very much for inviting me here today.
Do you think, as is being suspected, that over the last week or two, the numbers that we're getting out of the NCDC as being our caseload for COVID-19 have probably become even less representative of our caseload than before?
Well, I think the NCDC themselves have flagged up this concern as early as August, when they said that there was a 36% decline in testing of cases. And because of that, they were going to support the states who seem to be silent or very weak in terms of their communication and their testing. So definitely there is there's still, the numbers are not very representative because we have seen that in the past few months, people have really not, in some states, been getting themselves tested, just taking themselves to the testing sites, even though the NCDC has actually increased the number of laboratories from 3 to 70 across the nation, and they're making lots of efforts to ensure that there is testing. But yes, I'm not quite sure it is very representative because I know they are making, and all the government agencies, relevant government agencies, are making efforts to ensure that we have even more testing. So I think it's a bit better from August, but there still needs to be a little bit of work done on that.
But we seem to be faced with a catch-22 situation, and let me explain what I mean. In the last 12 days, about 12 weeks or thereabouts, you've had the End SARS protests on one hand, which have led to mass gatherings of people, and the medical experts are saying that we're likely to see the results of that 2 weeks from now, possibly in increased numbers of cases. But at the same time, the incidents happening around the protests have meant that many of those who do the testing, the labs you mentioned and so on, have not been able to conduct tests.
Yes, that is correct. There is a little bit of an issue there because, like we all know, there are the protests which ended a couple of days ago, in quite a bit of, in a lot of problems, really. So we have that issue. And we even have the issue where a lot of the protesters, they did wear, I saw some of them wear masks, but most of them were not wearing masks. So I can, in a sense, agree in a public health sense with the professionals who say that there probably is going to be a spike and we need to prepare for it in the next few weeks. I can actually agree with that. With
We know,
regards to the
Doc,
people,
that there's, I don't know if you can hear me, Doc, but if there's going to be a spike, if you agree that there's going to be a spike, how should we prepare for it?
well, we now need to shore up our testing very, very seriously. And I think there's one big thing that we need to also look at, and that is our risk communication and the way we communicate. I believe that the government now needs to hire even more professionals, communication media professionals, to really, really, really blanket the nation with infection prevention control procedures, just general advice about hand washing, about wearing masks, just letting people know that this is something that could happen, and we do really need to be very, very careful about it. So we need to really start from the basics again, go back to basics, and just revamp and renew our effort to communicate. At the same time, we need to review our efforts to not just communicate, but also to start to test. The young people are vectors of the infection, as we know. We also need to start to shield the older people. We have to start to ask the older people to now isolate themselves. There's something called shielding, a process called shielding, whereby we can actually educate the older ones and those with coexistent conditions to stay in their homes and only go out if absolutely necessary. So it's not even just talking to the young ones alone. We have to speak to the older ones, and we also have to speak to those with pre-existing conditions. So I would say it is communication number one, and then preventive measures number two.
Let me take you in a slightly different direction, but something equally interesting. I was speaking to one of your colleagues here during last week, and one of the questions that came up was the issue of wearing face masks for extended periods of time, very long periods of time, and if there were any medical risks inherent in that. And that question came up because quite a number of people have asked the question, is it safe in a controlled, aerated environment like an aircraft to be on face masks for 8, 10, 12 hours while you are in flight, and then when you get down, you are still not able to remove the masks because you are in the airports, which is another controlled environment. And how do you notice if somebody is actually in distress behind the mask?
It is, I think lots of studies have been done with regard to this. This has been discussed before. I'll give you a little example as to what doctors do. Let me talk about surgeons, just to, in a sense, illustrate my point. Like you probably know, surgeons spend upwards of 6 to 12 hours in controlled, air-conditioned environments, standing up to conducting surgery on patients. And they wear their masks. Sometimes they feel, it's true, they do feel a bit pain sometimes, but they get over it very quickly. And so, like I say, 6 to 12 hours they're there, sometimes 18 hours. They do take breaks, 4-hourly breaks. Sometimes they cannot take breaks. And we find out that they're not washed up in their respiratory system. Now, we have a group of people who have lung conditions, who have respiratory conditions, like asthma and chronic obstructive airway disease and conditions like that. They already have deficit with oxygen demand, and they will need to intermittently wear their masks. Now, in controlled environments, which is aircrafts, what I can suggest for people with respiratory conditions is that they inform the authorities beforehand so that special arrangements can be made for them. This is so important because somebody with respiratory conditions cannot wear a mask for 12 hours. They will actually faint. Now, you asked me another question. You said, how do people know that they are having the problem? I've seen some of this information, in the social media. Sometimes the social media, everything is not correct. And there was a particular gentleman who we saw was preaching and he was wearing a mask and he dropped dead. That's what he said. Can I just say that the human being is a very, very self-preserving creature. And you will know when you are feeling uncomfortable. There are many, many ways, there are many pathways towards the person feeling breathless and about to choke, about asphyxiate and stuff like that. By the time the person is beginning to feel suffer oxygen deficit, the body sort of like wakes up in a sense, and there are all sorts of reflex reactions. They start to feel uncomfortable, and you will know that something is going on. So I think I need to quell these rumors that people can just drop dead from the oxygen mask. It is not possible, as according to what I know today. I don't know everything 100%, but it is practically impossible for a person to just drop dead or go unconscious from wearing a mask. Like I say, it is a very, very uncomfortable thing for all of us to do. Even people who have 100% oxygen, they do still feel oxygen, their lungs are perfect. There's still a bit of discomfort there. So it is something we're all going to have to get used to because this is going to be a new normal. We still don't have a vaccine. We don't have a cure. All we have is a prevention for COVID-19. And so my suggestion again is we need to go back to prevention and ensure that we do all we can to prevent this condition.
Thank you so very much, Dr. Abraham, for your thoughts there, and particularly on those last two questions. I'm sure a lot of people have been very well educated on those points. Thank you so much for your time tonight.
You're welcome. Thank you very much.
Outside our shores, France will extend an overnight curfew to a dozen more areas in a bid to slow the spread of COVID-19. That's according to Prime Minister Jean Castex, who says the second wave is now very well underway. The 9 p.m. to 6 a.m. curfew will come into force at midnight on Friday, and some 46 million people will now be affected by the measure. This comes as countries around Europe are struggling with rising infection rates. Here's more on that in our global update.
Amid rising cases, the Spanish Health Ministry says the country needs drastic measures to combat an out-of-control new wave of the coronavirus pandemic and is considering new restrictions, including curfews. On Wednesday, the country reported 6,114 new cases of the deadly virus in the previous 24 hours, taking the total number of infections to over 1 million, becoming the first country in Western Europe to reach the grim milestone. Over in Germany, health officials say the country must prepare for the possibility of an uncontrolled spread of the coronavirus pandemic, but it's still able to slow it. While Germany's infection rates are lower than in much of Europe, they've been accelerating rapidly since the onset of cooler weather, with politicians warning that stricter social distancing rules may be needed if the trend continues. The country's health minister tested positive for the coronavirus on Wednesday. In Britain, as pubs and bars in Greater Manchester get ready to close their doors indefinitely tonight, many employed in the sector are left wondering how long they'll have to be forced to remain shut and how they will survive.
Cartwright has been very anxiety-inducing with the prospect of kind of moving off a kind of set hourly wage onto essentially a small portion of what I need to survive. So it's kind of already scraping the barrel, and now it's just, I don't really know what I'm going to do in the long term.
At the moment, we have no official definition of when it will end. We don't know whether it's for 28 days, for 14 days, or do we have to listen out for the non-existent statements which are going to tell us when we can reopen? That in itself is delaying anything we do for the future. We're going to be reactive as opposed to being proactive.
British Prime Minister Boris Johnson said on Tuesday he would bring in tougher lockdown restrictions on the Manchester region of northwest England, despite failing to reach a deal of funding support with the local leaders. The Swedish government says senior citizens no longer need to isolate themselves, pointing to lower COVID-19 infection rates than in spring and a growing toll on the mental health of its elderly as the reason behind the new recommendation. The move to ease the burden on the elderly comes as many countries across Europe are reimposing restrictions to get to grips with surging infections, but the health agency has said it does not see evidence of a second wave in Sweden.
And that's our COVID-19 update tonight. Thanks for watching. Of course, for more on those and other stories about the COVID-19 pandemic, even in the midst of so much going on, please go to our website, channelstv.com. There you'll find the details of those stories and indeed stories on other issues, business, politics, and sports amongst them. Channelstv.com. Thanks for watching. I'm Ladi Akere Doluale. Good night.